Dr. Francoeur, can you tell us what kind of spring we're having in terms of allergies? It seems like every person that I'm encountering is suffering from allergies this spring.
This year was definitely a very strong one in terms of pollen. Actually, these pollen are the one from the trees, and we definitely noticed that for those that were already known with hay fever, they were strongly affected by the fact that the forecast was prone for pollinization, meaning there was nice sunny and windy weather, which, is easy to carry more pollen. And even for those not known for allergy, it seems that it was more irritant to their nose or to their eyes.
So stuffy nose, itchy eyes, what else should parents be looking for, and what should they do about it if they see these symptoms in their children?
Okay, the most typical symptoms are for the nose, it's an itchy nose, runny nose, especially with clear secretion. The child will tend to have more rubbing of their nose, sneezing and sniffling. In terms of the eyes involvement, you can have rubbing of the eyes, itchy eyes, and redness of the eye, and sometimes we can even notice some swelling of the eyelids. And this is not in the context of an infection, so there's no fever.
And so then once you see, how many of these symptoms do you need to see before you take action as a parent?
Well, basically, obviously, the more you have, the more evident it's related to allergy to pollen. However, you don't necessarily to need all of them. And what we suggest to the parents is to give the child antihistamine that are available in syrup, like Arius or Claritin. Please get some advice from your pharmacist, because obviously, depending on their age, the amount is different. And for some child, it will be a good way to differentiate between allergies and a normal cold, because if it's allergic rhinitis, which we call a fever, it will be helped by this medication.
So now we've just talked about spring. Let's move on to the summer. What should parents be watching for in terms of allergy, potential allergen, sources, and what should we be doing about it?
In terms of the summer season, it's a continuity in terms of the pollen, because right after the tree pollen season, around May, June, and July, it's going to be the pollen from the grass. And later in the summer, August till October, or the first freeze, is the ragweed season. So basically, pollen are there for the whole summer period. Other than that, we notice that children, especially the one with sensitive skin that have eczema, are more prone to have more local enlargement reaction from mosquito bites. This is not an allergy per se to the insect, but it's more like a local reactivity, more sensitivity. Obviously, there are some children and older ones that may develop an allergy to wasp or bees, but it's very rare. However, it's always good to keep on hand an antihistamine medication. And for helping to relieve also the symptoms with the nose and the eyes, doing some nasal wash with saline solution is very helpful. And there are also eye drops that will help to relieve the complaint for the children.
Now, let me ask you, as a pediatric allergist, what kind of sort of trends are you noticing with allergies in general in children? Are they starting earlier? We're not just talking now about, the spring and summer and pollen and that kind of stuff, but allergies in general that you're seeing in your practice.
Totally. All the allergy problem, which we call as atopic problem, include eczema, food allergy, hay fever, allergy to animals, to dust mites, to pollen, and asthma. All those pathologies have increased tremendously over the years, and this is definitely a problem that we notice especially in industrialized countries. And for now, the explanation is what we call the hygiene hypothesis. Obviously, it's a complicated issue because it involves many factors. It's definitely multifactorial, but we definitely know that the family history is very important. So if one parent have hay fever or asthma, any allergy, their children have run about 30% risk to develop one or the others. Not necessarily the same as their parents, so that's important to know. And if there is two persons in the family, whether it's the mom and the brother, this risk raises up to 60%. So meaning it's very frequent to have many family members affected by different type of allergies. However, we cannot just blame the genetic background, so there's also environmental factor, and that's why we realize that for countries, for example, like India or Africa, there's very little allergy. However, the immune system is super stimulated to fight infection, which is not the case for us as Canadians. We are lucky, we live in a very good environment. However, the immune system is, I would say, a bit kind of maybe too lazy, and we live in very environment that is well controlled in terms of the hygiene, and unfortunately, allergy is an, I would say, an exaggerated immune response. So we produce too much antibody against things of our environment that should be seen as, as normal part of their life. So unfortunately, it's a problem, especially in very well-developed country as Canada. And we consider that now for allergic rhinitis, what we call hay fever, it affects up to 25% of the population.
Now, obviously, allergies, it's a large topic. You were talking about all the different types of allergies that exist. But in general, what general tips and advice can you offer parents in terms of being proactive about handling allergies if they do show up in their children?
Is definitely to be I would say, keen to recognize any abnormal symptoms and to consult, because what I realize, especially for the allergic rhinitis, or what we call hay fever, people tend to deny it and doesn't necessarily realize how much it can affect the quality of life of the child. So if you have any concern, please do not hesitate to speak about it with your pharmacist, because some of the medication are available over the counter. However, it's important to seek for medical opinion and really to consult your family doctor or your pediatrician if you are worried. In terms of taking care of any children with allergy, the most important thing is prevention. So to stay away of the offenders. So that's really my main goal as a pediatric allergist. So that's, again, another important reason why to consult, because when we are able to pinpoint the cause of the allergy of your child, obviously it's easier to give focused advice. So in terms of the environment, obviously we don't want to keep the children inside of the house all the time, but they are things to do. For example, keep the windows closed both in the house and in the car, to use the air conditioning, to change the filters because the pollen will be trapped in, to avoid putting the laundry to dry outside, because the pollen particles are very, very tiny. Actually, some of them are not even visible on their normal eye, but it gets trapped to the clothes, to the bed sheet, and even to the pets. So your cat or your dog, if you have one, will bring this and carry this in your house. So important, they have to be washed as well. Some kids, it will be important when they come back from playing outside to change their clothes and to have a shower to remove the pollen from their hair. So these are kind of advice that are very important for the pollen, but for house dust mite, we have other specific recommendation, as avoiding the carpets, all the stuffed toys. So honestly, again, I re-insist how important it is to give some advice to control and avoid the offenders. And there are some help, non-pharmacological help, like for the nasal wash. It's done with saline solution, and it's very helpful to clean the nasal passage and to avoid this pollen to stay in the nose or in the eyes, and it will also help to remove all the bugs, because the younger the children are, they don't how do you say, they don't use the tissue easily. Mm-hmm. So all the bacteria or virus can stay in the nose and eventually duplicate and give some infection. So it's very important to wash their nose. And in terms of the eyes also, there are lubricants that exist for both the eyes and the nose. So those non-pharmacological steps are very, very important and key. And for those that is not enough, then we have a variety of different step approach we have, but the first one that is available over the counter are the antihistamine, but we have specific other medication but needs a prescription by your doctor.
Last question, Dr. Francoeur. We're almost out of time, but I did want to ask you, if your family doctor has determined that you need to see an allergist, many parents will tell you that it is almost impossible to get an appointment with a pediatric allergist in something less than a year or several months. Is that what you find, and what are some tips you can offer parents to get the help they need in the time that they need it?
Yeah. So that to say that unfortunately we are not very many allergists in Canada, but you have to know that most the pediatric, your pediatrician, your family doctor can begin an approach and a treatment. Our role as a pediatric allergist will be mainly to confirm the diagnosis and with the questionnaire, the question we are asking you, and the physical examination, and the skin test will be able to confirm what are the cause of the allergy. However, with simple questions, even your family doctor and your pediatrician can help you to determine that, because it's usually related to a temporal relationship. So, and as I said, just for the pollen, there's a typical calendar in different areas of Canada. So it's just by asking the question, we can, doing the Sherlock Holmes can help us to determine. So obviously, as we always said, since the waiting time is a bit obviously long, well, we'll help the parents in the meantime to consult some website that will give them some proper information. And for different area of Canada, for example, in the Canadian Association of Allergists have a website. Our Quebec Association of Allergists have one dedicated for the public also. Asthma and Allergy Canada have also a very important tools that can be given to the parents in the meantime.
Such a lot of great advice. Thank you so much, Dr. Francoeur.
It's my pleasure. So let's enjoy the summer with all those advice.
Thank you.